Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I'm excited today to be talking about why your dentist is working in the dark, why dentists are blind to what they can actually do in dentistry. But first, appropriately, this podcast is brought to you by Tooth App's insights into your business. The key metrics like profitability, like net new patients, finally for the first time available in dentistry. You can actually, with a glance, see the valuation of your practice. Check it all out at toothaps.com. Well, if you're a dentist and you turn off the lights and you can't see anything, how great is your dentistry going to be? I mean, think about it. Think about trying to find the MB2 on an upper left molar, which is already difficult, but with no light, zero light, like total darkness. You're totally blind to what's going on. Would you want to do dentistry? Would you actually see the patient? If you're the patient, wouldn't you be freaking out? I think so. I mean, think about it. I wear 4.8 times loops. That means that looking at something I'm looking at, it's basically 5 times bigger when I'm working. You think I'm going to work without light? Absolutely not. Absolutely not. I wouldn't do it. I think I would be worried about the quality of care. Wouldn't I? I mean, if you can't see what's going to, just think of the negative consequences that would happen if you're working blindly, if you can't see what you're doing, if we're doing dentistry by feeling, right? Well, obviously, nobody's going to be doing that. Nobody's going to work when they can't see what they're doing in dentistry. Now, we can visualize, I think about, like, let's say you're working on the distal of a second molar and you can't see what you're doing, but you can feel, right? There's some areas like that where we got to work without full information, let's call it, when you can't see what you're doing. But if you're not going to do that, if you're doing a sealant on a tooth or you're doing a root canal, you've got to be able to have the information that, either radiographic information or visual information, so that you know what we're doing. However, today dentists are working blindly due to the lack of interoperability, which means information, the lack of information, the data to actually do the dentistry that we need. Think about this. Let's say you're an endodontist. You do root canals, right? Would you see a patient with no light in the room? We talked about it. Absolutely not. You're not going to start working on a patient without being able to see. However, if that patient comes to your office with a slip of paper that says, I need a root canal 14 circled, that's it. What do? Well, you probably take another x-ray, right? So that patient probably just had an x-ray at the dentist across the hall, but if they didn't bring it with them, you probably exposed the patient to more unnecessary radiation and take an image which might be better, might be worse than the last image, might show what that other image showed, might not, right? But why do we not have access to that patient's entire dental record, entire history of the tooth? I talk about it in my upcoming book, but there's a scenario that I think about often. If, let's say, a patient moves to your town and they have a root canal, well, that's 1.5 millimeters short filled. So the patient's had a root canal, it's filled all the way, except for one of the canals is just a little short, and there's an abscess, and the patient's complaining to chewing on that tooth. What do? That patient just came to your office. They could have moved across town or they could move across country. And you look at this x ray, or maybe it's a CT scan, and you can see this abscess in 3D glory. And you can see this root canal that's short. What do? Do you call up the dentist that patient came from and say, hey, what happened with this root canal? And they say, I don't know. There's a dentist before me. Okay, well, let's call up that dentist. And that dentist says, oh yeah, I remember Betty. Yeah, she had that root canal done. It was 8 years ago. I referred her to the endodontist. Oh, okay. Well, I'll call the endodontist now. Then you call the endodontist. First of all, nobody's doing this, right? But let's say you did. let's say you burnt the calories and you follow the trail for this patient. You're turning on the lights, so you're getting information about this patient. You call the endodontist. You say, hey, do you remember Betty? Yeah, let me dig out the paper chart from 8 years ago. I laugh, but it's probably true. Let's be honest. Let me look at the film X-ray that I took back then. Oh, okay. Let me send that to you. Yeah, right. That's not going to happen. But okay, no, this was a forward-thinking endodontist. We did a digital X-ray. Here's what it looked like. Oh, yeah. We did the root canal and had trouble negotiating that canal. Did the endodontist look in their notes to see what happened? Do they look to see that there was a fracture on the pulpal floor that was thin, so they didn't know whether or not the root canal would take or not? And they told the patient, Betty, this might not work. And if it doesn't work, I wouldn't recommend redoing the root canal. I would recommend extracting the tooth and having an implant, right? Now, that happens all day in dental practice across the country when we see new patients. At my practice, when I stopped practicing seeing patients on a day-to-day basis, we had 125 new patients a month. What that means is that basically, on average, you know, let's say we saw patients 15 days out of the month, or roughly, or I saw patients 15. But if you do the math, right, that's let's call it two patients a day in the average patient practice, two new patients coming in a day. Yeah, I'm new here, and then okay, we'll get your records from your other office, right? What do you get? What you get is a akin to doing endo with the lights off. You're working blindly. You don't actually have the information, right? It's too crucial, people. I mean, the getting information from the patient, because it's the patient's records, right, is crucial. And even if that patient never left your practice, let's say they're traveling, they go, they live in Minnesota, but in the winter times it's cold, so they go to Arizona for the winter, right? And they have a problem when they're in Arizona, right? Or switching dentists. I mean, or going to see another dentist, a specialist. What we're doing right now is we're forcing ourselves and our colleagues to practice blindly because we don't have the information about the patient. Medical information, dental history, radiographs, and of course, I'm including connections with our medical colleagues, bringing in the medical problem list so we can, for the first time, actually see what's going on with that patient's medical history today. Even if the patient doesn't think that it's important, if they tell us whether or not they have diabetes, right? It is important, and we should have that information so that we can take care of the patient the best we can. So we can turn on the lights, put on our loops, and actually see what's going on with regard to a patient's dental care. It's no different than trying to practice with the lights off, practice blindly. If you don't have the information, I've been thinking about this a lot lately because obviously interoperability is, and having patients and dentists have access to this crucial data. It's of utmost importance, I believe, right now for us to solve this problem. So that's what I'm focused on. And we focus on treatment outcomes a lot in dentistry. If a crown, let's say in one practice, an average crown might last 10 years, in another practice it might last 12 or 15, and one it might be 9. So treatment outcomes are obviously vitally important to track. But of course, the next question is, did a crown need to be done in the first place, right? I did a lot of inlays, onlays, partial crowns, didn't require full coverage crowns, but because of the payment systems that are going on in the US, I believe those are being underperformed, right? So too many teeth are losing too much tooth structure for the sake of billing and ease of use, which again, another talk show, but vitally important. So whether or not the treatment should be done is kind of pre precedes whether or not that treatment outcome was successful. And before that, we go to diagnosis. Let's diagnose what should be done, right? Does this tooth even need to have a crown, or does a sealant work? I mean, diagnosis is important. Do we need to do a root canal, or should this be an implant, right? And to actually make that diagnosis, what precedes that is information, is data, and we need to have that information to come up with our differential diagnosis, to come up with a definitive diagnosis. And we can't have access to that data if it's locked in a data prison like most practice management systems, most software companies have today. Interoperability is vital to quality of care. It's the first step in improving care and unlocking innovation in dentistry. That's what we're trying to do, both with the standards that we're creating at the American Dental Association and at Dental Standards Institute, through Odin, through IDRA, through the revision of 1084, and through the platform Tooth Apps, and what we're doing here at Upgrade Dental with the book that we have coming out, Dental Disorder. Check it out. Pre-register for your copy at dentaldisorder.com. And let's turn on the lights. Let's put on the loops and get us out of this era where we are treatment planning blindly, diagnosing blindly, because it's been accepted for too long. Interoperability is a way to turn on the lights, to put on the loops, and actually see what we're doing. And it's available today. Go check it out at Tooth Apps. And of course, I'd love to hear what you have to say about the podcast, about this topic of interoperability. If you don't think that interoperability of data, of having accessibility to crucial patient information is important, let me know. Like, comment, subscribe. If you believe this is an important mission, please tell somebody to listen. Hop on and subscribe to the Patient First podcast. Our subscriptions are going crazy. Personally, I think it's because of this mission. I think people believe in this mission, and even if you don't believe in it, it's what's being federally mandated. It's just the entire industry is out of compliance, and as far as I know, we're the only ones solving this problem. So join the cause. Go to toothapps.com. Get your copy of the book at dentaldisorder.com, and I look forward to talking with you next week right here on the Patient First podcast.